Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show, bringing you another really fascinating guest today who has been involved in creating a better tomorrow throughout her career. Today we have the honor of being joined by Dr. Peggy Hamburg, internationally recognized leader in both public health and medicine, who currently serves as the chair of the Nuclear Threat Initiative's Bioadvisory Group, where she's also served as the founding VP and senior scientist. And she also currently holds a role as commissioner on the Bipartisan Commission on Biodefense. Dr. Hamburg previously served as Foreign Secretary of the National Academy of Medicine and as a former commissioner of the United States Food and Drug Administration, having served for almost 6 years, where she was extremely well known for helping to advance regulatory sciences, modernize various regulatory pathways, and help globalize the agency. Prior to that, served positions including Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services, as Health Commissioner of New York City, and also Assistant Director of the National Institutes of Health, National Institute of Allergies and Infectious Diseases. Dr. Hamburg currently sits on multiple boards, including the Commonwealth Fund, the Simons Foundation, the Urban Institute, Gavi, the Global Alliance for Vaccines and Immunizations, as well as a variety of others. Dr. Hamburg earned her bachelor's from Harvard College, her medical degree from Harvard Medical School, and completed her medical residency at Weill Cornell Medical Center, and she is the recipient of multiple honorary degrees and numerous awards. We're honored to have her with us today. Dr. Peggy Hamburg, thank you so much for joining us on the show.
Well, thank you for inviting me.
It's great to have you. I'd like to start off, I think, about 20 or so years ago, when you were the commissioner of the New York City Department of Health and Mental Hygiene, because at that time, in addition to everything you were doing in terms of helping reduce HIV transmission and dealing with sort of a resurgence in the spread of tuberculosis, you started publishing several papers at that time on biosecurity and bioterrorism, titles like hemorrhagic fever viruses as biologic weapons, SARS and implications for U.S. public health policy. We've been lucky. Talk a little bit about what was happening a couple decades ago and what sort of got this theme, which ultimately will feed into our discussion at NTI, about your concerns in terms of bioterrorism.
Yeah, well, really, I had not thought about biological threats in the broadest sense until I was health commissioner in New York City. I'd been very focused on infectious disease, had worked, as you noted, at the National Institute of Allergy and Infectious Diseases. And of course, as New York City health commissioner, was dealing, with a lot of infectious disease concerns from, really it was a period when HIV was really becoming pronounced, the resurgence of tuberculosis, and now in a more deadly form of drug resistant. There was the emergence of some unexpected diseases in New York City, thanks to travel and trade, and a set of ongoing infectious disease concerns. But I'd never thought about the deliberate use of a biological weapon to do harm in any serious way. But when I was health commissioner, the World Trade Center was bombed for the first time, and we sometimes forget about that. But for me, that was a wake-up call that the threat of domestic terrorism was quite real. And as the chief health officer for New York City, I needed to really think in some new ways. And I started thinking about all the vulnerabilities that could impact health. And of course, bioterrorism was one, I started to learn more about the history of biological weapons, and that included, of course, the state-sponsored use, but also the possibility of a subnational group, or even just a rogue bad guy.
Mm-hmm.
I had the great opportunity also, I have to say, to learn at the side of Dr. Joshua Lederberg, who was quite a revered and renowned figure in the world of infectious diseases and microbiology, but also a leading thinker on deliberate use of biological agents to do harm. And he was at Rockefeller University. And so, we worked together a lot. We ultimately were able to publish together and to serve as the co-chairs of an important committee at the National Academy of Medicine, then the Institute of Medicine, called Microbial Threats in the 21st Century. But that was really how my interest emerged. And I have to say, at the time, there was only a very small group of us who were seriously engaged from a public health preparedness and response perspective in the bioweapons, bioterrorism area. And many of my colleagues in the infectious disease arena and public health, really sort of were concerned that I was going a little bit off the deep end. But I think, the events of later years, demonstrated that we do need to have this broad approach. And I think we need to continue to keep a strong focus on biothreats in all their many dimensions, including, more attention to issues around biosecurity and biosafety.
Yeah, in the NTI just recently, you published this paper establishing a joint assessment mechanism for enhanced biosafety and security, talking in it about sort of biologic events of unknown origin, and you point out, okay, we have all these situations, overpopulation, destruction of the environment that serve very well for zoonotic issues. And on the other hand, you go into the fact that we have these 60 maximum security biosafety for laboratories all around the world. We got to make sure they're operating pretty well so we don't have accidents. Talk a little bit about some of what you do on a daily basis, or you think about these horrible problems at NTI, but take us into that, if you would.
Well, on a day-to-day basis, I'm trying to focus on things that can be done that can make a difference in the present, but also planning for the future, and trying to do that in a way that's as sort of streamlined and likely to be effective and doable as possible. And so a lot of that is really thinking about building out capacity in this country and around the world for basic public health functions that will protect the health of people and prevent disease, including, of course, communicable diseases of all kinds, but also systems to rapidly recognize the emergence of an unexpected disease outbreak that could signal worse to come. I really do think that we need to strengthen and extend, core public health and its relationship to our healthcare system on a day-to-day basis to be, prepared to surge should, we face a serious disease epidemic or another global pandemic. And I think COVID-19 has certainly shown a spotlight on the deficiencies in our current capacities, whether it's in the United States, which clearly should have been much better equipped in its and effective in its response to COVID than it in fact was. But many countries, really don't have the kinds of resources and capacities that we've had in this country over time, inadequate as they may still be, sadly. But and we need to work on that. And then, I do think it's really important to continue to educate the public and policymakers about these issues. And we saw during COVID how important that was, and that the public's lack of a full understanding of what we were addressing and how it needed to be addressed certainly I think was unhelpful to the overall response, and certainly failures of leadership, were very undermining, and we're digging out from a situation where the public has lost confidence in many of its important public health and political leaders and institutions. And then, lastly, with respect to biosecurity, I think we still are not putting enough attention on biosecurity and biosafety issues per se. Mm-hmm. And that becomes even more important now. I think that, the threat landscape has shifted with COVID in a number of ways that, may increase the likelihood of either a deliberate or inadvertent laboratory-related bio event. Mm-hmm. We know, of course, having watched COVID unfold and its far-reaching impacts, that a biological event can be catastrophic, can be devastating to health, but also to economies and livelihoods and to safety and security of populations, and of course, to political leadership as well. Yeah. And so that might make the deliberate use of a biological agent more tempting to some groups. But more than that, I think we have to be realistic that the very advances in scientific research that will help to yield better understanding of microbial threats, and the very studies that are done to help us develop better countermeasures, diagnostics, drugs, vaccines, to address potential biological threats, also may make us more vulnerable. Mm-hmm. It may mean that we're doing studies that are sort of almost like roadmaps to how do you make a virus more lethal or mm-hmm. more transmissible, or more and more countries want to be doing research on pathogens of pandemic potential, but they may not have the kind of biosafety, biosecurity labs and regimes to do that work in the safest way possible. So I think this is a time when not only do we need to be strengthening our public health institutions, but we also need to be providing responsible stewardship of the critical, valuable tools of modern science and technology to address these threats, but really making sure that work is done in appropriate ways with the right oversight and sense of accountability.
Outstanding. Peggy, moving to your leadership at FDA, because you were known for many things during your time there in terms of advancing and streamlining and modernizing the agency, Food Safety Modernization Act, Family Smoking Prevention and Tobacco Control Act. You did a lot of major initiatives, and on one hand, you have, as commissioner, you have these amazing responsibilities to guarantee our drugs are safe and efficacious, that we don't have adulterated foods and misbranded consumer products and so forth. On the other hand, you wrote a bunch of papers on topics like personalized medicine, nanotechnology, just generally advancing regulatory sciences while not stifling innovation. And, I think I said the public's been granted sort of this interesting case in the last couple of years in terms of the COVID vaccines and emergency use of how fast innovation technically can happen. Talk a little bit about sort of this balance that you have to keep, as commissioner, that you had to keep in mind at the time. That you got to protect the public, but you got to make sure that innovation happens at the same time.
Well, it is a fundamental challenge of the FDA and advancing biomedical product innovation, balancing risks and benefits, and trying to do that work in the most streamlined way possible, but avoiding any unfortunate harm to people that would not only be an acute problem, but could also undermine confidence going forward. With a vaccine, you mentioned the COVID vaccines, that was an extraordinary effort to advance the science of the development of a novel vaccine technology with the mRNA vaccines in a remarkable time frame. FDA and other regulatory authorities provided incredible leadership from the get-go, really thinking about how can we structure clinical trials for these vaccines in ways that can compress some of the time frame and telescope some of the pieces of the research needed to assess safety and efficacy, but without compromising rigorous science.
Mm-hmm.
And that was very, very important. The process went forward with more risk in terms of financial risk and risk of failure, but there was a concerted effort that was adhered to ensure that we actually collected the data to know whether these vaccines were safe and if they were effective. And I think that really mattered, not only because it doesn't do you any good in a pandemic if you're using a vaccine that doesn't really work. Sometimes there is a sense of something is going to be better than nothing, so just get it out to people as fast as you can. But the worst thing you can do, in my view, is to put something out there that people think is going to work and then it doesn't work, or worse yet, doesn't work and it causes harm, because of course with vaccines you're giving a product to people who are healthy to try to keep them healthy.
Yeah.
And so you certainly don't want to introduce unnecessary safety risks as well. But more than ensuring that we had products that would really work and that we understood about how to use them, I think that this very rigorous adherence to good science, even as timeframes were accelerated in historic ways, was very important, because already we were introducing these vaccines against a backdrop of incredible uncertainty and skepticism, existing vaccine hesitancy, and the anti-vax movement, which has been undermining confidence in vaccines and uptake of vaccines in ways that belie the science and what's best for children and adults and families from a health perspective, but in the context of a pandemic become even more pressing. So we were up against that. And then, understandably, in the kind of raucous political environment and divisive political environment that COVID was unfolding in as well, and the fact that everyone knew we were moving in this accelerated way. And I think naming the vaccine project in the US Operation Warp Speed probably didn't help, because people felt that the process was moving forward in unnatural ways. Really being able to speak to the rigor of the science, to be able to be open about the data, to bring in independent scientists for review of the studies, and in the advisory committee meetings, I think all help to support the assessment of the vaccines and their uptake.
Can you say a couple of words about, you wrote this paper with 6 other former commissioners of the FDA talking about, the recommendation of FDA sort of coming out of HHS and being it's sort of independent, sort of reconfigured federal agency. Just say a couple of words about why and how you got together to write this. And then at the same time, this is sort of a second part of this from my FDA regulatory stuff here. Food. Food has changed a lot over the years, and obviously, before 1906, the Department of Agriculture and then FDA's responsibilities. Is food still something that you think should be a responsibility of FDA versus another type of agency that would think about things as broad as, the safety of our pepperoni, and on the other hand here, stem cell derived food. So there's food falls into a lot of categories nowadays.
Well, one thing that's very striking about the FDA, and to be honest, I didn't fully appreciate until I was the commissioner, is just how broad and deep the responsibilities are in all the different areas food product, of products that Americans consume. FDA actually regulates, it's almost 25 cents of every dollar that consumers spend on products is regulated by the FDA. In addition to that, the range of domains of science and technology that underlie many of these products and their appropriate regulatory oversight. So FDA is an amazing agency in terms of the depth and breadth of its responsibility, and the importance of having a really expert and dedicated staff. The focus on foods is an important and timely one. If you go back, you noted that FDA was created in 1906. It was actually President Teddy Roosevelt that created the FDA. And it was in response to a number of food safety concerns, as well as some issues about fraudulent medications. But from the very beginning, FDA really has had a very strong food focus. And it remains today in terms of its budget. Part of the budget committee is a subcommittee of the agriculture committee, so it still is very embedded in that world. But so much of its work is not in the food area. The food area, to be frank, hasn't been as well funded or supported or understood for a very long time. And I think, that has been unfortunate. FDA doesn't regulate all food in the United States. I think it's about 80%, but it doesn't regulate meat, when you mentioned pepperoni, or eggs. But it regulates a huge swath of food. And when I was commissioner, was the first time that really the food safety program was really modernized in about 60 years, and implementing that new regulation that was the result of a bipartisan bill was something that was a high priority for me. And I think that unfortunately some of that important work got a little bit stalled with transitions in leadership, as well as, of course, COVID. And the funding, as I think I mentioned already, for the food and nutrition component of FDA has always been less than on the drug side. And the medical product side, drugs and devices, have special sort of contractual relationships with industry, with strong firewalls, but industry helps to support some of the work because it's in their best interest for adequate staffing, facilities, et cetera, in terms of getting products approved. We haven't had that same kind of support on the food side. But I think that many of the same kinds of thinking, the same kind of data-driven decision-making, the assessments of risks and benefits, and the efforts to try to provide appropriate oversight in a rapidly changing environment fits with other responsibilities of FDA in other domains. And, maybe I'm just a little old-fashioned, but I kind of like the idea of seeing it remain the Food and Drug Administration. It's partly, the legacy and the tradition. But I think if that's going to happen, it needs to be adequately supported. It needs strong leadership. It needs, ongoing attention day to day, as well as thinking about the strategic future. And I think, this is a time of reckoning for the FDA in terms of how best to approach it. You can argue, why not bring together the food safety components that are in agriculture, the food safety, outbreak investigation capacities that are with CDC, as well as with FDA, and sort of create a more unified whole in that regard. But there are important synergies within each of those agencies of these programs, that would be diminished. There's also very different legal regulatory requirements that would have to be modified. So it would take to change it. It would take a lot of work. Maybe it's the right thing to do going forward, but I would say let's not do it on the spur of the moment because the political winds are shifting or whatever. Let's do it in a serious, thoughtful, stepwise way so that if we reconfigure, we do it in a way that really, is most appropriate and will better position the agency for the future. Just one other footnote to an already overly long answer, but another thing that's happening in the food and nutrition area, though, is that there is a growing sort of overlap between medical products and certain food nutrition products.
Yeah.
And, and that probably really does belong with the FDA, the whole sort of area of nutraceuticals, et cetera. So, I think this is a discussion that's ongoing and will continue to be had. But my greatest message is, let's do it in a thoughtful way that really allows us to get all of the issues on the table and think them through before we start to make changes. And that then leads into your other question, if you still want me to address that, about
please.
It could be an independent agency. And I think the answer to that remains yes. And I think COVID has reminded us of many reasons why that should happen. FDA is a regulatory agency that has very unique responsibilities and huge responsibilities, as I mentioned, in terms of the oversight of products that really matter to people every day and in a crisis. Other regulatory agencies that have similarities with FDA, like the FTC, the Federal Trade Commission, or the FCC, the Federal Communications Commission, or the SEC, the Securities and Exchange Commission, are independent regulatory agencies. And in fact, the Consumer Safety Agency spun out of FDA, and it's an independent agency.
Yeah.
But FDA is not. And I think, that harms its ability to fully do its task. It harms its ability to be as efficient as possible. And I think, it can undermine both perception and reality of independent decision-making from other vested interests. I think you can really track. This isn't a partisan issue. It's not, the Republicans are bad or the Democrats are bad in terms of political interference into the work of FDA. I think it's just a fact of life that when FDA is embedded in an agency the way it is, that it becomes more complicated. And I think the modern world has made it all more complicated. And I think you can sort of track going back, quite a number of administrations, quite a number of decades, and FDA has become, I think, more and more politicized as, the world of social media and 24-hour cable and the sort of intensity and divisiveness of politics has shifted. I think, there's more and more intrusion of political decision makers into some of the work of FDA. And I think that reflects the fact that FDA every day is making really important decisions and making important decisions that, very often someone is unhappy about, whether it's industry and, they see dollar signs if a product isn't approved, or people who are looking to FDA to get access to drugs they need, or want to make sure that the infant formula they're feeding their kids is safe. There's a lot of stuff that gets in the news, and the White House doesn't always like that. In fact, at one point, I was told during my tenure at the FDA by someone in the White House at a fairly high level, why can't you be more boring at the FDA? But, certainly I experienced some episodes that were very uncomfortable to me as FDA commissioner. I know colleagues at FDA before me and colleagues afterwards, similarly had concerns.
Got it. Peggy, as I mentioned in the bio at the beginning of the show, you also served as Foreign Secretary for the National Academies of Medicine. And in 2017, in JAMA, you, Victor Zhao, and others published a paper entitled "Vital Directions for Health and Healthcare Priorities" from the National Academies of Medicine initiative. I had Victor on about a year and a half ago, an episode talking about one topic, the National Academy's Healthy Longevity Grand Challenge, and this is clearly a component of this paper in terms of the aging of the global population. I could just wonder if you could say a few words about the Healthy Longevity Initiative per what you experienced as Foreign Secretary from a global perspective, and then also, second part of that, coming back to FDA now, one of the things I hear from people working in the healthy longevity domain is this sort of this lamentation that FDA doesn't recognize aging as a disease today, and that hinders stuff. I'd just love to get your thought on sort of that concept, whether you think aging is or should not be classified as a disease, for the development of some of these health span therapeutics that are coming down the pipeline.
Okay. Well, starting very broad and then getting, more narrowed in on the aging question. I mean, I think, almost all of the major challenges in science, medicine, and health today, as well as all of the broader challenges facing our globe, really do require responses and strategies that, not only cut across disciplines and sectors, but cut across borders. And really the best work and the best solutions are going to be found by working collaboratively. And that was actually something I felt strongly about when I got to the FDA, in part because I realized that the products we were regulating, whether in the medical product sphere or in the food domain or other areas, the products were actually being were coming either in whole or in part from countries around the world and through complicated supply chains, and that if I was simply going to define my job as protecting and promoting the health of the American people, I needed to care about what was going on in countries around the world, and that no matter how well resourced we were never going to be able to inspect every factory and packaging plant. We weren't going to be able to trace all of these products through these complex supply chains. And so my feeling was that we needed to work with other regulatory authorities. We needed to help strengthen regulatory capacity in other parts of the world. And we needed to share information, both information about products and potentially emerging concerns, et cetera, but also share workload. I mean, if many countries are getting products that are coming from a certain manufacturing facility in India or China or wherever, we don't all have to go in and do separate inspections. Mm-hmm. We can share information if we have common standards and practices. And so I worked a lot on that, and actually was part of helping to create a new global governance mechanism that proved very, very useful during COVID. But I came into the FDA having strong interests and having done work in global health, and that continued at FDA and has certainly been reinforced by my work as Foreign Secretary at the National Academy of Medicine. Actually, I just took on a new role, for better or for worse, as co-president of an organization called the Inter-Academy Partnership for Science, Health, and Policy, mm-hmm. which is an umbrella organization for academies of science and medicine and engineering around the world. So obviously reinforcing this sort of global approach to problems. And the problem of aging is certainly one where there is no society anywhere in the world that is completely immune to the process of aging. There certainly are some groups that seem to do remarkably well in terms of aging compared to others, but aging is a natural process. It's embedded in, I think all of our bodies, in our cells, in our genetic makeup. And so in that sense, I think aging doesn't have to always be framed as a disease. It's a natural process, but there are many diseases of mm-hmm. aging. And many of the diseases of aging have very meaningful opportunities for interventions that can slow that aging process or make that aging process less debilitating. there are some people who believe that perhaps we can stop aging altogether. For me, I don't think we're ever going to find the fountain of youth, but I might be wrong. I'm not sure that would ultimately be a good thing for the human population, unless we also at the same time are developing other parts of the universe to live on in whatever, because, our Earth has a carrying capacity, and if nobody dies, that's a problem. But I think that there are, really, really important diseases that are manifest as part of an aging process that have been underaddressed, where we both haven't applied the kind of preventive tools that can make a difference in terms of lifelong habits that influence the aging process, but also better understanding some of the diseases of aging, in particular neurodegenerative disease stands out, where, I hope, are poised to really apply advances in science and technology to make meaningful differences in the burden of some of those diseases. But it's hard to sort of define aging from a regulatory perspective and looking at clinical trials. It's a little bit hard to just say, well, aging is a disease, because you have to have more clarity about endpoints if you want to understand interventions, and that's part of the challenge. And there are some, there have been many discussions about certain products that could potentially just slow the aging process of cells in a more generic way. And so how do you assess that, and how do you structure those clinical trials? I would like to say that FDA always tries to be open about how to address concerns that people bring and opportunities to make a difference that come before them. But I think one does have to always be thinking about how do we do meaningful, rigorous science so you get answers that make a difference.
Absolutely. Peggy, looping back now to sort of the bio, as I mentioned, you started your career out at the NIAID working on HIV at a time when it was a death sentence. Here we are, 2022. We've profiled the City of Hope patients on the show in terms of the stem cell leukemia transplants, which sort of they call a complete cure. Andrew Hiebler from the White House on talking a little about his work in
also
terms
from
of
NTI.
Yep, absolutely. NTI there as well, talking about how we can eradicate reservoirs. Looking back to the very beginning of your career now, looking at talk a little bit about how you feel about sort of the progress we've made in HIV and in that transition from death sentence to not just something that's livable, but that something might be eliminated completely.
Well, it's pretty remarkable. I mean, going back to sort of my early career in medicine, the emergence of HIV when I was a medical student, transformed my career path. I had planned to be an academic physician. I was going to do research. I was going to take care of patients, and I was going to teach. And I thought I liked endocrinology. I thought I'd do either reproductive endocrinology or neuroendocrinology, and I did some research in the neuroscience space. But then when I went, to medical school, it was really, it was the case that the sort of dogma was that the era of infectious diseases was sort of coming to an end with the advent of drugs and vaccines and advances in science, and the future of medicine was going to be much more chronic disease. And then this, unexpected syndrome, a poorly understood set of medical challenges emerged. Nobody back then knew what it was, what caused it, even what to call it. And then over the next couple of years, we came to understand more and learned about, the human immunodeficiency virus, and it got a name. But there was still, when I was a medical resident in New York City, we had nothing to treat patients with except supportive care. And, once a patient came in and was on a respirator for pneumocystis carinii or a fungal disease, we did not get them off the respirator. I mean, we lost them. And watching, people often of my age group, my cohort, dying these terrible diseases, and even one of our residents was lost to HIV during that period, really made me change my mind. And I felt like, we don't have any treatments for this disease, and yet, it's so horrible and devastating. But in addition, it was creating all these other complicated problems and challenges as well. It was, at the intersection with social, legal, political, economic issues. And that was when I really thought, I want to learn about health policy. I want to learn about public health. I hadn't learned about those things in medical training or medical school. And that was when I went down to Washington, and I had the great good fortune to become Tony Fauci's special assistant, and then to help him lead the institute, but and work on how do we develop therapeutic interventions that will make a difference against this devastating disease. And watching what has happened has been amazing. So many lessons learned that stuck with me and certainly applied when I was at the FDA, going back to your earlier question about balancing risks and benefits, and trying to speed innovation to people in need. But also, I think it's right now, it's a good reminder of the importance of not thinking that every serious disease threat of an epidemic nature is going to have a vaccine fix. We were lucky with COVID that it turned out, to be an infectious disease process that was quite amenable to a vaccination strategy. With HIV, we still don't have the much sought after vaccine, and it's not for want of trying, but we do have, medical products that are making just a transformative difference. And so I think for me, not only does it irritate me, I have to say, when people, say that the COVID-19 pandemic is the first pandemic in our lives or our memory, because, HIV counts for me. But also it's a powerful reminder that we have to have diversified research investment strategies. We have to really understand, the nature of the disease, the underlying, biology of the disease process, but also the human impacts of the disease, what symptoms, really matter, what impacts on your ability to undertake, certain important aspects of day-to-day life, be able to undertake those, and how medical interventions can help to improve the quality of life, and reduce the burden of disease. And then also always thinking about how do you prevent disease from happening in the first place, and how do you prevent unnecessary spread. It also, sorry to give long answers, but
no, it's great.
To me, it also, HIV is a powerful reminder. Monkeypox was another one just recently, that if we care as a nation, speaking now as a US citizen, more about disease that's happening in other parts of the world, even if we don't see it as an immediate threat within our borders, we will all be better off, both because, I'm a humanitarian at heart, and deeply believe in helping others if we can, but also, you don't know how things are going to unfold. If we had taken more interest in, the wasting syndrome that was occurring in Africa, we might have been better prepared to deal with the full-blown emergence of HIV. If we had taken some of the tools that had been developed, that could be used against monkeypox, it had actually been developed because of the concern of smallpox as a bioweapons threat. that we had the smallpox vaccine and some of the other potential therapeutics. But if when monkeypox had been happening in Africa, Nigeria, for example, has had, some significant monkeypox challenges in recent history. If we had, been more invested in helping them, we could have better understood the appropriate use of some of these medical tools against monkeypox, and we would have been much better positioned when monkeypox emerged in the United States, and we also would have done a service to other people in other nations.
Absolutely. And for everyone listening and watching, I know we're coming up against a hard stop, but I recommend everyone check out Dr. Hamburg's Lancet article from 2021 with Secretary Shalala and others, a global health action agenda for the Biden administration, which really synthesizes a lot of this theme of international cooperation that Dr. Hamburg is talking about here. So Peggy, I once again, I know you got a hard stop at the top of the hour. I really appreciate you taking the time to educate us on these themes. You've had a fascinating journey, and I'll continue to root you on for everything you're doing now with the NTI, with the Commission on Biodefense. Any last messages for the audience while we have you? Anything hot coming up that we should know about, and then I'll let you get on to your next set of calls.
Well, I think reiterating the message of we need to care about health, we need to care about investing now in things that matter to people's health every day, and that isn't just what happens in the healthcare system. It's also having a strong, robust, well-functioning, well-funded public health system, and a continuum of programs and policies that address health, from the community level and population health to, the need for hospital-based and intensive care and everything in between. And then the need to, think about health from a global perspective. How can we make our understanding of some of these challenges stronger by working together, because science is a global enterprise, but also how can we work together as we harness that science to make a difference in people's lives wherever they live, whoever they are.
Excellent messages. For everybody that's going to be listening to this particular episode of the show across the various podcast networks or watching on our YouTube channel, again, you've been listening to Dr. Peggy Hamburg, Chair of the Nuclear Threat Initiative Bioadvisory Group, Commissioner, United States Bipartisan Commission on Biodefense. Peggy, again, I want to thank you for taking the time out of your schedule to come talk to us for a little while. Obviously, thank you for everything you've been doing. And as we say on this show, thanks for helping to create a better tomorrow for others via what you're doing. Really great story.
Well, thank you so much. It was fun talking with you. And I'm amazed by how much you read. You resurrected papers.
I'm amazed by how much you write. Be well.